Hello and welcome. Today I'm joined by Dr. Lee Herrington. So he's from his home at the moment, I can see. But Lee is a physio and researcher. So I've known Lee for a number of years, but I'm really looking forward to hearing from him. He's got a good social media presence, so I'm looking forward to see if we can access some of that today as well. Lee, how are you doing?
I'm all right. How are you?
Yes, all good, all good. So as I said at the start there, so I've known you for a number of years and had the pleasure of interacting with you at EIS and at Salford. But just my introduction of physio research is obviously a very generalist thing. Could you just give me an update of your job titles to date?
I suppose as we sit here today, I am a senior lecturer in sports injury rehabilitation at Salford University. And that role involves me being program leader for the MSc in sports injury rehabilitation. And I also, I suppose I work in, I'm trying to remember the title of the research centre. It changes regularly at universities as is their want. But fundamentally, I work in essentially an interface between biomechanics and sort of like clinical outcomes and injury prediction. So my research at the moment is mostly at the universities around the biomechanics of movement and how surgery or injury changes that, and how we might then do interventions to take people back to normal movement. And equally, and probably in equal measure, is using movement to predict injury, or probably more accurately predict injury risk, rather than, you probably can't predict injury, but you can probably predict a relative risk. So that's the university stuff. I act as editor-in-chief for Physical Therapy and Sport Journal, which I've been doing for a couple of years now. And I'm also on the editorial board of Journal of Athletic Training, Journal of Sports Rehabilitation, and the Knee. So that's a really fortunate job. You get to see lots and lots of papers prior to publication, and unfortunately you end up rejecting 80% of them, but you're still sort of very, very current with where people are at. So that's quite a privilege. And then my special job, my fun job, is I work for the English Institute of Sport as what is now an athlete health lead. And within that role, I probably have three parts to that. I work on a consultancy basis, sort of dealing with N of 1 athletes when they have specific problems. So working with the practitioners embedded in the sports to help athletes when they've got specific problems. I probably lead on trying to develop insight into injury. So it's not research, it's probably understanding into our injuries and how we might optimize their management. And then the final bit is similar to the education role. I help develop our practitioners within EIS. So we mentor and try and develop their already very high skill sets further. So that's today.
Yeah, so just to go into that, we'll go back to the beginning in a second. But so when you're working with people that you do at Salford Uni, but then you're also developing people at EIS, how does that differ in terms of your approach to how you do that?
I suppose it's the MSc is a strange group of people, because you can get some relatively inexperienced people in terms of miles under the on the clock, and you can get some incredibly experienced people who want to come along. So within the university, it's probably a lot more flex around trying to understand where they're at in terms of their sort of learning journey, and making sure it's, I suppose the phrase is, age appropriate. So you wouldn't necessarily challenge them in the same way you would challenge a very experienced practitioner. So you're probably more coaxing their understanding and pushing them along. And there's probably a little bit of what we'd call the tell space, where you might be telling them some information and then seeing if they can get meaning from it. Whereas probably at the other end with the guys in EIS and some of the more experienced guys, you're probably in the experience sharing space and sense making, and we use a lot of analogy and storytelling and comparative stories. So in this sport, this has happened. How does that fit with your world? Do you think you can apply that in your world? So there's probably a lot more sense making and understanding the world, and then trying to enhance their understanding of their world. Whereas at the other end, it's probably understanding knowledge a little bit more.
And EAS has got a real reputation for being absolute top level in terms of the work of sports medicine. How do you find that environment to work in yourself?
It's great because you've got a group of people who probably are incredibly focused for what we'd call a cycle, which is Olympics to Olympics, and then we will lose people. We have natural wastage. We call it churn. But when they're in, they are very much in and committed, because there's quite a lot of focus to an end point, which is an Olympic Games. So in that respect, it's really interesting. It probably differs to the team sports where you've got Saturday, and perhaps it's almost you're sometimes trying to survive from week to week. We can very much step back and look at the big picture, and we'll look. At the moment we're looking towards the Paris Olympics, but even when we're having discussions with the sport and the practitioners, we talk about LA as well. So the LA Games. And when we're looking at how they interact with athletes, you'll talk about, okay, is this something we're just doing to get them to Paris, or is this a junior athlete we see as an LA prospect, and how we manage them differently? So I suppose the working in there is different because your dynamic is always shifting. It's not, sometimes it is cold hard focused on we need to get them fit for this weekend because there's a trial, a champs or whatever. But quite often you're able to take a slightly longer view, which is probably the difference of environment, and it changes your perspective a little bit. It probably decreases some of the stress and the panic.
Yeah, but then when it comes around to that 4-year Olympic cycle,
yeah, when it comes around to the games, it properly comes around because it's it. There is not another Saturday.
Yeah, well, I'm sure we'll come back to that later on. So just getting back into your history then. So how did you get involved? You're from the Northwest originally?
Yeah, I sort of always lived up this way. So I probably was one of those sort of like frustrated sports people. I was okay at sport. I was decent enough to make county standard across a couple of sports and things like that. So I went off to Loughborough University, which is still a beacon for people who love sport. So I did human biology at Loughborough. And it was at the time, which really dates me, physio actually wasn't a degree course. It actually became a degree course while I was at Loughborough. And so sort of like really interested in anatomy, really interested in movement, really interested in exercise. Oh, this physio thing looks quite interesting. I'll go and do that. So I came back up to Manchester and did physio degree after human biology down at Loughborough. And I suppose was one of those semi pain in the arse students who had a pretty solid idea what they wanted to do at the end of it. So I would beg, steal or borrow as many musculoskeletal experiences and placements as I could during that 3 years. And I was very fortunate. A couple of the places I went, they humoured me and they let me stay beyond placements into the summer and stuff like that. So I suppose I got a lot of weeks of exposure during my undergraduate. And then I got lucky as well. One of my supervisors invited me to work in his sports injury clinic straight from graduating, which was over at Man City in the old training ground at Platt Lane, and which was the most amazing experience. I worked 3 evenings a week, essentially seeing a patient every 20 minutes for like 4 hours. So you were just seeing millions of patients, and most of them were just lads who played football or girls who played netball. They wanted to know what their injury was, when can I go back to sport, what do I need to do about it. So you spent a lot of time assessing and having to devise like rehab programs on the fly. So you banged in a load of hours. My other evenings and weekends were then spent like working with local rugby teams, just doing match day stuff and things like that. So that morphed into sport. Did the usual NHS stuff in the day, but again, probably fiddled that to work a lot in orthopedics and stuff like that. Wasn't really, again, the model go around your physio rotations person.
Right. So when you did you did the human biology at Loughborough, and then did you have something in mind, because a physio wasn't even a degree then? Did you have an end in mind then?
I probably went to Loughborough because it was bright light, shiny city. In all honesty, it's still. I mean, even more so now. You go to Loughborough now. It's an amazing place for sport, and it is. I'm slightly biased being an alumni, but it's probably the most switched on university in the country. It knows what it is and it knows how to market it. So even then, you went and you were knocking about in the bar with like England internationals and Great Britain athletes and stuff like that. So it was always a good place to be. You know, so from the sporting side, you went and did circuits with like a Great Britain athletics coach took the session, and you were doing it with like judo athletes who were internationals and track and field athletes who were internationals, all doing circuit training together with these like slightly idiot rugby players.
And so what was it like then going on to do the physio course then? Was it a downer, or was that good straight away?
It was interesting. And in some respects, I'd probably get into trouble for saying it, but I don't think physio's changed in some ways. You know, I turned up being reasonably strong on the exercise side, being reasonably strong on like the background to that, so physiology, anatomy, biomechanics, thinking, oh great, we're going to do loads of that, and we didn't. And so you got probably a little bit frustrated because it seemed quite archaic, and you know, and I remember my first year anatomy and physiology exam sort of getting pulled in and saying, oh, you've come close to failing your essay. And I was like, that's quite a surprise, having a degree in this area already. And they'd taken their information from like what would be a first year textbook, and you were giving them an end of degree information, and they were just like, didn't get it. So I think sometimes we have a physio anatomy and physiophysics and physiobiomechanics interpretation. And I think sometimes perhaps we need to realize there is another world which has interpreted these things slightly differently and operates at a different level.
I mean, that's an interesting point in terms of that then. So how do you see it, because you're involved in both worlds of like the research side, so very technical combined with the practical side. How do you find a way to make those two meet and mesh?
You probably you ask the question constantly, how's this going to make any difference on Monday morning? So sometimes there's got to be some very abstract, really like basic science has got to be done. Stuff in a test tube, you know, the components of a tendon and a tendon cell and all that, and that's great and fantastic, but that's never going to translate into meaning for normal people. So I suppose the focus of research, or my research, has always been on, well, what's the bigger picture? How is this going to change what we do? So if we understand the biomechanical forces in sprinting, let's say, we can then understand the loads which go through the hamstring, so we can understand how we might have to strengthen and rehabilitate that hamstring. So that might start with what appears to be a very dry biomechanical paper on the forces involved in sprinting. But if you're smart, you extrapolate that out to some meaning into, well, that means, if I'm being really obvious, if if the force is 4 times body weight at X degrees per second, there's no point me doing an isometric mid-range 50% exercise and saying they're fit to go out and run again. We need to somehow leverage our rehab towards those loads. So there's probably a lot of, sometimes we need to have the vision to see what the information means. And that's why I think research is translated badly, because sometimes the people doing the research don't understand the clinical need, and the people doing the clinical need won't make the effort to understand what the numbers mean in the research.
Yeah. So do you see it then? So like, this is a big question, but like from an art versus science perspective, where do you see physio or human performance?
There's always art. If you actually, and I think that's the problem at the moment. I think if we flip that the other way, you get a lot of people talking about evidence-based medicine. There will never be evidence for everything you need to do with a patient. It's just impossible. You can't do that many studies. That many studies can't get published. And even if they did, the chances of you being able to find the information and use it. So there will always be a gut, an instinct, a belief versus knowledge scenario, where I have a belief that this will happen rather than I've got absolute tacit knowledge. So I think you've just got to be comfortable with it. We talk a lot with the EIS guys, you've got to be comfortable in the grey. You're always going to be working in the grey. You're never going to have absolutes, especially because our population in elite sport is so skewed. You know, you're outliers. To win a gold medal, you've got to be an outlier.
Yeah.
So you're never going to fit to a population norm.
Yeah.
So just got to go for it sometimes and go, there isn't evidence, but if we use our reasoning and we have a rational process and a good underpinning philosophy, we can probably get close to a decent answer.
Yeah. Yeah. No, I think that's a good way to position it. So then go back to after you've done some of those placements, you'd worked in NHS. How long were you doing those for, and how long was that?
I'm trying to think. On and off, I was probably in and out of the NHS for 4 or 5 years, but like 80-90% of that was orthopedics and musculoskeletal. I think I did 2 non-orthopedic and musculoskeletal rotations in my time in the NHS. And even then, I think I was doing elderly respiratory, and I was still wanting to get them up and get them walking around the wards, and going, well, the best way to get your chest exercising is to get out of breath a bit, innit? And funnily enough, 30 odd years later, with COVID, everyone was like, yeah, we need to get them up and move them about and get some air into their bases. So I feel 30 years later vindicated.
Yeah. And then, so how did it translate into you starting to do work in that at university?
The university was probably a little bit down the line. I did my master's at what was Crewe and Alsager, which went into Manchester Met. And so that was Sports Science of Injury was the title. And so again, that was very much at the interface of sports science and injury. So heavy emphasis on psychology, physiology, biomechanics, research methods, and then how you apply that to managing injuries. So I suppose I was there, and an opportunity came up to join the teaching team. So they needed somebody to run their student clinic. So I ran their student clinic for half the time and taught for the other half. So that was my sort of introduction in. And obviously having access to a student clinic meant you had a lot of little guinea pigs to research on. And like, because you had some toys to play with, even though the toys in those days weren't anywhere near what they are now, you could start to build sort of like, at the very least, mental databases of what things meant.
Mm. So was this at Alsager?
Yeah, I was down at Alsager.
Yeah, I did my sports science there. So what were you there?
Blimey, when did I finish down there? Must have been around 97 probably.
Right. No, I went in '97, but I'm sure like Paul Williams and some of those,
Yeah,
some of the same people would have been there. And
yeah. So Neil Fowler, Paul
yeah,
Williams,
Brendan
Neil
Maguire.
Roach, Brendan Maguire. You probably just missed Les Berwitz as the head of
No,
program.
no, he was there
Les was
because
still there.
yeah, because he was carrying on for a while in terms of running bases, wasn't he?
Well, Les was a great guy, and one of Les's comments is probably pertinent to any discussion you have about teams. And he very much talked about, everyone talks about the multidisciplinary team. And he said, nah, that's a load of rubbish. You need an interdisciplinary team. So a multidisciplinary team is a series of people working in their individual discipline silos. So all you've got is multiple disciplines in a team. Versus if you've got an interdisciplinary team, in theory, those disciplines are meshing and working across each other to bring out the best. So that's a Les Berwitz quote from ages and ages ago, which always makes me laugh when we talk about multidisciplinary teams. I say, oh, we've got multiple disciplines in the room. Excellent. How are we going to work together then?
Yeah, I'm going to
So
use
it's a
that.
Les.
Yeah, that's a good one. So do you still keep in touch with any of the team there for a while you were working and since you moved on?
Just by sheer fluke, I actually share an office with Neil Roach, who now
Right.
works at Salford. So Neil's actually, we share an office.
Yeah. Well, it's it's a housing estate now, isn't it? So I've been back a couple of times and it's all
Yeah,
it's
and
all gone.
even when they moved over to Crewe campus, that's all gone, and they're now back at Manchester.
Yeah.
Actually, at Platt Lane, as it happens, where I started doing the sports injury clinic. That's where they're based.
Right. Yeah. Full circle. Full circle there. So you were doing the clinic there, and then how long did you stay at MMU for then?
I stayed at MMU till I went full time with Wigan Rugby League. So I was working at MMU. Story of my life is, as my wife will tell you, I like having multiple jobs and making my life complicated. So I was working part time with Wigan Rugby League at that point, where I was looking after the academy and the reserves, and doing a little bit of work on main match day with the first team, but not the first team physio. Got a chance to go full time first team with Wigan. So at the time, and this is really testing everybody's, they'll remember some of the names, but the Wigan team had people like Tuingamala, Rydlinski, Farrell, Betts, a Fire. God, there's too many of them to remember. A Fire. So it had the greatest rugby league team in the world, basically, which is probably not far off the greatest rugby team ever in the world. So you get an opportunity to work with those boys. You think, oh, we'll give it a go then. So had a couple of years then with Wigan, full time.
Right. And so what was that like going into that? Because I'm not particularly a rugby fan, but I remember that team was absolutely insane. I used to love the ones where they'd play against the Union team as well.
Yeah, that was my era.
Right.
The
That was
two
amazing.
games with Bath and the Middlesex Sevens. Yeah.
But didn't Wigan sometimes win the other one, or certainly it was close?
We came. The slightly biased person would be we played Bath at Twickenham for the rugby union game, and Bath only started to compete and win when they played very, very old school rugby union, where they stuffed it up their jumper and kept it in the forwards, because obviously our guys couldn't play forward based rugby union. That wasn't their thing. But as soon as the ball got open field, they were just devastating.
Mm. So what was it like being in that, then going into that environment? For one, what was the medical setup like, and then what was the dynamic like?
It was, if you pardon the language, it was piss pot rifle. So it was me. So the best rugby league team in the world had a physio, a doctor who came in on match day and one afternoon a week, and a masseur. And then we got a couple of like ex-students to cover the academy.
So
And that's how it started. That morphed a little bit over my time there, but fundamentally, you had a couple of members of staff and a part-time doctor. The head coach, an assistant coach, and a trainer who did some of the physical preps, what we call physical prep now, so the conditioning and the weights. That was it.
Right. So
And the gym was underneath a main stand at what was then Central Park, which is now a Tesco's.
had you followed Mark Leather in then? Because he was there around that time.
I actually was not long after Dave Fever.
Right.
A well-known name.
Yeah. No, indeed. So what was it like then? What was the dynamic with that team? They're ultra successful.
It was great. It was an amazing learning thing because you had good athletes. You started at a very high base, but it was Saturday to Saturday. I mean, you literally had a squad of 18 players. 17 men had to be on the pitch on a match day. You got one significant injury and you were scrabbling around, so you learned to put out fires, along with trying to be as efficient and effective at rehab as possible. And it just was a place you had to learn fast.
Yeah, and that, I mean, rugby league. We had a couple when we had the clinic in Didsbury. We had a few that came in, and they definitely had some interesting stories to tell. Like from your experience, how does a rugby league mentality differ to other ones that you've experienced?
They're definitely unique. The nature of the sport is just, it demands a very high level of fitness. It demands a high level of commitment, and you've probably got to be on a scale of 0 to fearless, pretty close to fearless. So yeah, it was always interesting, and you've got to be, any of those environments, you've got to be quite robust to work with those people, because you're not going to be able to intimidate them. So you've got to find another way to win them over and add value. You've got to get their respect, or you don't. If you don't have their respect, you're never going to get anything done, because you're not going to be able to bully those guys into doing something.
How did you go about getting their respect then?
I won't tell the joke I told to a very senior former Welsh international on the bed the first day I walked in, because it's very crude. But basically, it went along the lines of, I took the mickey out of him and said, "But if you punch me, I've got to hold your ankle, and I'm always going to win this, because if you knock me out, I'm going to break your ankle as I fall over. So we have a I can always inflict more pain on you than you can on me while you're injured." Which did result, after the rugby union game you mentioned, which was his essentially retirement game, on me being dragged around the bus in a headlock, telling everybody the said joke, and then getting hit on the head with a beer can, to the point where I had blood running down from a little cut. But that's how much he sort of loved you.
So how long were you at Wigan for?
Probably 5 years in all. And then
that was full time?
No, I was part-time, then full-time. And then various reasons, which Wigan fell rapidly from a high position, to a degree due to management things, which happens in sport. Sometimes coaches just lose their way. And so it was like, for me, in all honesty, it was the manager losing his way, going, this can't work here, because there's no consistency. And also my little boy was born, and it got to, he was about 3 months old, and I figured out I'd actually not had a day off. There wasn't a day I hadn't been in the club. And so at that point you just go, it's not worth that much. So you go, okay, I'll just move away from this a little bit.
Yeah, well, he did well to last that long doing that, really, then.
Well, my child was born, and I got a phone call literally about an hour after he was born, going, "Are you coming into the club today?" And you're a bit like, "Oh, I'd sort of like today off." "Yeah, but we got a game on Saturday. We need these players fit." And it's improved to a degree in sport, but there still is this all-consuming, the sport, the thing is the priority, and they perhaps forget that they'd get more and better decision making out of their staff if they gave them a little bit of work-life balance.
Yeah. So where did you go to after Wigan?
So I went a little bit in a private hospital, which was great fun, and went to Salford. So I split roles between a private hospital and Salford, and then after a little bit of time, went full time at Salford. Did some private practice, did some rep stuff, so rep team stuff for a few years. So the private hospital was great because I got to do 1 million post-op rehabs, which of course was just great. So that was really good. Went into Salford, started to do some stuff at Salford, and still did private work and kept my hand in with sport. Like I'd go and do county level teams and some junior international stuff as well, just as touring, traveling stuff.
Yeah. So how did Salford, because that was at the university you're referring to?
Yeah.
How did that come about? Was that something that was research, something that you wanted to get into, or education?
I suppose I'd done the education piece and a bit of the research piece when I was down at Alsager with what was Man Met, becoming Man Met. And then I'd almost taken time out to have some fun in sport. But at some point you sort of went, I probably need to go back to a day job, which has some security and has a pension and all the sensible things in life and is of interest.
And so what was it in particular then did you go into a specific role there?
No, I was just a lecturer in sports, the sports injury rehab undergraduate program at the time. But sort of like I suppose my attitude to research was we had 40 undergraduate students doing research projects for their dissertation. So it's like, all right, well, that's 40 opportunities to collect data towards something useful, because previously every student did not a meaningless project, but not necessarily meaningful. So I would set what we call mass data collection days for the students. So I'd have 10 students doing projects, all very linked, and we'd get 100 students in and collect data on them across 10 projects or whatever. So we could start to get meaningful data, which we could then get out and publish and stuff like that. So I was probably a master manipulator of the circumstance. And some of my colleagues said it wasn't proper research, but sort of 200 and odd papers later, I still haven't written a proper research paper, but they're still in their 20s writing proper research papers. So you can decide what more impactful.
What would you describe as a proper research paper then, or
no? They would describe a proper research paper as one, I suppose, which is incredibly internally valid. It's very tight on the methods and very inscrutable, and invariably has teeny tiny amount of translation to the real world because it's so constrained in what it did.
Yeah. And how would you just define it then?
Sometimes you just have to do quick and dirty research to answer a question. Can I measure strength reliably? Using this piece of kit. What is a normal level of strength for this group of individuals? If we do X, what happens to Y?
Yeah. And at what point then did you start to get the particular interest? Like you're more synonymous with ACL. At what point did that particular interest develop? Was that natural, or?
I was always doing lower limb stuff as bits and bobs, and so I did a lot of we had ACLs obviously when I was even with the student cohort down at Alsager. So we had post-surgical knees were the biggest group because we had a big group of dancers, we had female footballers, female netball players, football and rugby on the male side. So you saw ACLs. So I'd always seen them. So it just became almost a morph to dig more and more into it. And I sort of don't see myself particularly as an ACL researcher. I see myself as a knee researcher, and a lot of the mechanisms are very similar. If you do a lot of repeated load, you injure your patellofemoral joint or your tibiofemoral joint. And if you do a really high sudden load, you might injure your ACL. So they're all on a bit of a continuum rather than, and I think that's part of the problem. It's like, they research tendons and I only think about tendons, or they're only a shoulder person. instead of going, actually, what I know about shoulders, can that translate to ankles? Or I will probably get to it, but I went and did a few years working at one of the British Swimming Intensive Training Centres at Stockport. So I went from, okay, I'd done shoulders in rugby, plainly, but I went into swimming, and all I did was took my mental approach to lower limb into how I'm going to approach a swimming shoulder. So if you've got a good underpinning process, you can apply it. And I think that's sometimes the problem. Instead of we try and think about what's the process here, we want a solution. So we go, oh, give me an exercise to solve this problem, instead of, if I go back to first principles, what I know about a knee, well, how much of that can apply to a shoulder in terms of, and at a big picture level, everything can apply to a shoulder. At the minutiae of specific exercises, you've got to tailor them, but you still need to, if you've got high level principles, you can apply them. And you've got good base knowledge around anatomy and movement and stuff like that. It doesn't take you very long to actually figure out some exercises. And you ask stupid questions of the coaches, which is my want in life, and go, this swimming thing, well, what do you do then? What do you do what's the phases of swimming? What do you think's involved? What are the stresses? Why do you do that training program? You know, have we got any video underwater? And I was really lucky, we had underwater video of the swimmers, so I could watch the stroke mechanics, and I could sit with really great coaches who'd coach people to multiple Commonwealth Games and Olympic medals, and go, what's that then? But I'm still surprised how many people don't actually watch the sport. They watch the sport as in, I remember going to the football once with my dad, and they scored a goal, and he's like, did you see that? And I went, no, the player in backfield's down. I think he's done his ACL. And he's like, but you missed the goal. And I'm like, no, I didn't. I saw it. They said that happened and that happened, but you went like that. You went, one eye was on one part of the pitch and one was on the other.
And so do you think that there is too much emphasis being put on? I mean, even though you're, again, I referred to you as around knee, do you think there is too much emphasis as being a specialist in one particular area, if it's Ian Horsley or Joe Gibson or whatever with the shoulder?
No, they're slightly different beasts in that they've both got really good process, so they could probably apply themselves to other stuff. But don't tell Ian I said that. They'll have amazing process, and I know them both. I've known Joe since we were both on like junior training courses in the NHS, so they'll have good process. I think what's more important is when we're teaching this way back at undergraduate and master's level, we don't teach things in isolation. We try and teach a process. Can you apply a construct to the whole body rather than, right, today we're going to study the knee and these are knee exercises? It's actually, well, there's certain principles of exercise which you probably can, if you understand them really well, you should be able to apply them to anything. Okay, they won't be the sexiest exercise. My shoulder exercises will be nowhere near as sexy as Joe's and Ian's, and they probably won't be as efficient and as effective, but I'll be 90% of the way there because I've got good process. They're probably 10-15% better than me, and that 10-15% is hard. That I'm making it sound like there's not a big difference between me and Joe and Ian at shoulders. There is, but that last 10% is quite niche, and most of the time 90% is good enough.
Mm-hmm. Yeah, no, that's an interesting perspective then. So when you were, did you do your PhD was done at Salford then?
Yeah.
And how did that come about then?
Again, because slightly weirdly, I was probably one of the first people at Salford to do what was called PhD by publication. So what you do is you accumulate your publications and you link them together as a story of how you've developed knowledge in that area. So it's similar to a thesis, but instead of doing maybe 3-4 studies for your PhD, in my case, I had 3 areas, all of which had about 6-7 papers in. So, and then you put them all together as a story, and then you defend how you've changed knowledge at the end of it. So it was slightly different, and I can't decide if it definitely wasn't an easier way of doing it. It was probably a lot harder than doing a normal PhD, without belittling a normal PhD, which is incredibly hard work. But it was definitely, especially at the time, because the examiners had never seen this sort of PhD. So you did seem to spend half your time defending what was the indefensible. It's like, well, I don't like the way this has been written in this paper. Yeah, but it's been accepted. I can't change it now. And they almost one of the examiners almost wanted the 18 papers in the thesis, wanted them all rewriting. And you're a bit like, that's not the point.
So how did you come to do that way of doing the PhD then?
Because I was just too busy to take 3 years out and do a normal PhD. That's probably the bottom line.
Have you started doing your work in EIS at this point then?
No, that was later. So that again was another one. I probably spent my whole life with serendipity, and or Brownian motion, whichever term you want to use, an arty one or a physics one, where I bounced around colliding into things. So Ian, who we've mentioned, and a guy called Jim Webb, who was at Man City and then went to EIS, were both friends, and they were both working at EIS, and they said, "Oh, basketball need a physio for the summer. You won't be doing much with the university in the summer. Do you fancy doing basketball for the summer?" That was 2007, and I was dropping in and out of EIS at the time to do some consultancy. So I'd go in and do the odd hour and see a patient as like a roving consultant. So I did basketball, and I must have done an okay job. We qualified for Division 1 of the European stuff, and in fact it was 2006, not 2007, 2006. So we qualified for the top division. They asked me back the following year, did a 14-week summer with them where they qualified for the Eurobasket, which meant they qualified for London, or they're on the trajectory to qualify for London, which was obviously their priority. So did that, and then as I was hanging around at EIS a lot anyway, it was sort of like, well, do you fancy rocking up here in the rest of the year while you're doing the basketball in the summer? So just bounced into that in terms of from being a little bit of a consultant who came in and poked your nose in once every so often. I became someone who poked my nose into stuff a couple of times a week.
Where were you based for that then?
That was at Sports City at Manchester, which at the time, if you're thinking 2008, 2009, you've on an average, any given day you're in there was 4 beds, and you'd have an Olympic gold medalist on 3 out of the 4 beds at times. So it was just like, it was bonkers. It was, you came home and it's like, well, who have you seen today? Oh, well, you never guess who I've seen today. So yeah, it was crazy.
Who were some of the people that were coming through then? And then
think of your sirs and your knights of cycling, your dames of cycling. We had obviously all the taekwondo guys. We had quite a lot of the track and field guys who were still about in Manchester. We got a lot of the netball was based with us there up in Manchester still. So yeah, we had a whole variety. We even did England women's football a little bit. So we'd see the England women's football players, because that was quite an early development of that program before it became so full-time and professional as it is now. So we had a whole variety. We'd have Paralympic sports, across the board Olympic sports. It was a really good place for a whole variety, and again, just a crazy learning environment.
It's changed a bit there now, because like the velodrome came, and I was chatting with Phil Burt last week, and it was some incredible stories there. Well, they're all in one spot. Then even Taekwondo, who again have been
Yeah,
really
it's sort of just as they moved from what was Sports City to the Manchester Institute, so MIP, all the sports decentralised. So they all got their own venues. Taekwondo got its facility. Cycling very much moved lock, stock and barrel into the Velodrome. Track and field were trying to centralise down to more to Loughborough and Birmingham. So just as we got this very new, swanky, shiny centre, everybody buggered off. So it felt sometimes in the MIP like it was the Marie Celeste a little bit, where you're sort of like, is anybody in the building?
Mm. How has that been from a working perspective from your side in terms of that decentralisation?
My role probably shifted focus a lot probably around that time anyway. It became very much more a national role, so it probably didn't make a lot of difference to me. And EIS is quite a dynamic organisation. Everything changes every 4 years, so the whole thing is in a constant flux of change. So you adapt and move on. So my role had changed where I was probably spending more time out and about on the road anyway, going to the sports where they were. So it sort of didn't make a lot of difference whether that was a 2-mile trip up the road to Taekwondo or a 180-mile trip to Weymouth to sailing. It was you were going to work with practitioners, with athletes somewhere.
But you were still doing your Salford work alongside all this.
Yeah, we probably need to keep all the other stuff I do when I'm at Salford quiet.
Yeah, no, we'll do some of that. We had a really good team at Salford at that point, like with Phil Graham-Smith and somebody that I remember going for a day out with you to look at some isokinetic systems. But that was going back probably about 12 or 13 years ago now.
Yeah, I mean, Phil's at Aspetar now. Phil's done some great work. He's helped the whole Forstex thing, and then obviously that's morphed into Valve. I think he has an influence still with the Valve people. Obviously, Paul Comfort arrived at that time with strength and conditioning. Paul Jones arrived as well with his interest in change of direction, biomechanics, and all that stuff. So yeah, we had, and Rich Jones was there all the time with his sort of like what at the time was sort of walking gait and osteoarthritis, but we dragged him to the dark side of sport a little bit over the years. So yeah, it was a good team. It still is an incredibly solid team who probably punch well above their weight in terms of where we should be for a little ranked whatever we are as a university compared to the big boys. So yeah.
And then in terms of like sports rehab, like I've worked with loads of sports rehab people that have come from Salford and still do we still work with the guys at Bazerat, and it's been really good. How do you see that sports rehab physio? Bearing in mind Salford has both courses.
It's an interesting one where I think some practices, and if we just ignore sport, we'll come back to sport in one sec, but some practices get the best out of it. What with current physio education, especially a new starter, they haven't got that background in exercise and rehabilitation to the same extent, and probably they're stronger on the assessment side and some of those other bits. If I was owning a private practice, which I have sort of no intention of doing, I'd be very much, well, I can get the best out of two groups of people here. I can have someone in the gym who's dead keen to be in the gym, and I can have someone perhaps who's got a really strong skill set, if you like, in the treatment room, and also is able to, at their best, morph that understanding of pathology and the ability of tissue, a tissue level, the constraints of rehabilitation into the gym. So I've got a great interface. And the same, more and more sports teams seem to be seeing that, where they're looking for this rehabilitation specialist who sort of transitions from the traditional physio role in a club, which is almost getting people back the following weekend. And they sit slightly away from that. And the physio very much has a role in defining the workspace. This is the constraints of the tissue at the moment. And then almost there's these rehab people, and they can be physios or sports rehabilitators. I'm not saying one's better than the other, but it's a bit more of a unique skill set. And then you've got the S&C guys at the other end of that continuum, and the sports scientists, as they would call them in football, who then do the very on-pitch, very end-stage stuff. So if you're really looking for a blend, you could really take advantage of it. I just think sometimes people haven't got the vision, and we talked about multidiscipline versus interdiscipline. This is a classic example of multiple disciplines not seeing the best in each other, but putting up barriers to try and protect their own bit, where actually if they work together better, they would secure their own bit because they'd have clearly defined points of reference. I always think it's a shame that people perhaps don't have the vision of how they could work together better and use each other's skill sets rather than being very protective.
Yeah, no, I agree. Yeah, we've same with sports therapy. We've still got a couple of sports therapists on our team, and they're great. So no, I agree.
Yeah, let's look at the individual skill set rather than the badge.
Yeah. No, I agree. So in terms of like things that you've got planned going forwards, like anything you can share with us, any things you want to achieve beyond what you've done already?
I just keep bimbling along, really. I suppose we've Salford wise, we're probably going to move into this crazy world of machine learning and almost algorithmic understanding, get far cleverer people than me to do the maths. But there probably is something about amassing multiple data streams to understand injury risk and also patient performance post-operatively. So that sort of fascinates me, the whole, it's almost like what a clinician might already do, make the calculations in the head and go, okay, Jose, there's an 80% chance they're going to get injured on Saturday, but we can probably write algorithms to get it to 81% and be a lot more accurate. So there's something around data integration, which then involves getting cleaner data, more reliable data, understanding the meaning of that data more. So that's probably something which interests me. It may not happen in my lifetime because it's a massively complex area. And for the EIS side of things, we are just trying to optimize. We want to bring more medals back from LA than we did from Tokyo, or at least equal it if possible. That's always the aspiration there. And to do that, the Paris Games will be about availability to train and compete. So it is a physio and strength and conditioning games. If the physios and the S&C guys do incredibly well at building resilient athletes for the coaches to coach in the way they do, with the way they see the need to win medals, then we'll win more medals. Simple. Job's easy.
Sounds it. Yeah. So for that then, so like for EIS then, so is that something that is continually asked? Like how often is that question asked, right, what can we do to improve what we've done?
All the time. It makes it sound like it's every minute of every day is how can we be better. It's not like that. So without giving away loads of what we're doing, we're looking at concussion at the moment, and whereas some people are looking at the biomarkers of concussion and stuff like that, we're like, that's great science, but how good are we at managing it on a day-to-day basis? And so we'll look root and branch at what we do. Can we optimize our management first and foremost, and then we'll integrate all these clever people's knowledge into what we do, rather than like it's marginal gains. They talk about getting that 1%, but the bit they miss with the Brailsford quote is do 99 things 100% well, then sort out the last percent, and that's your marginal gain. But before you can have a marginal gain, you've got to do 99 things 100% well. So it is do everything brilliantly, get all the basics. We talk about brilliant basics a lot. Do the basics brilliantly every day, and actually you're well on your way to the performance. And again, a lot of practitioners, they want to go on a course and learn another technique and another technique and another technique, and you've got 10 techniques, but actually most of the time all those 10 techniques are no better than each other. So why not become really good at one or two of them, and understand the limitations and the constraints of those two tricks you've got. I probably am a one-trick pony. I go in a gym and I get people to run about a bit and jump about a bit. It's my only trick. I'm not that great manual therapist. I'm not that great at programming. I'm not that great at inventing exercises, but I can develop some adaptations in the gym.
So in terms of that then, so outside of like the actual medical side, do you like get involved with like reading any personal development, professional development books to talk about, like you mentioned marginal gains? Do you get involved in that?
I probably read more now, which is outside of, ignore my editorial roles, which I read loads and loads of physio based stuff. So I can't probably say I don't read physio stuff. I read loads of it, but I probably read more and more about, like management. So and I tend to do it as audiobooks because I drive a lot, and when I'm exercising, I'll listen to audiobooks. So I suppose I've just listened to most recently a book called The Expectation Effect, which talks about people's expectations and beliefs and how they dictate behaviors. So again, I'll probably do that. Big influential books for me are things like Daniel Kahneman's books. So he talked about thinking fast and slow, and then he's done Noise most recently. So Noise is probably one of I bore most people to death at the moment with Noise. So yeah, I probably read that sort of stuff as much as anything else, because there's a thing called wisdom of crowds, which basically is if all we work with are physios, all we get is physios' opinions, and invariably that's going to limit the diversity of the opinion and the knowledge and the information. So you need experts, but you also need diversity. And what certainly professions like medicine and physio have done is they've sat in a silo, and they've had some incredibly intelligent people, but they're still only thinking like physios. And you need disruptors and different thinkers and diversity coming in to really push understanding and knowledge on.
Yeah, no, I think that's really interesting. I've not heard of Noise and the expectation effect, did you say?
Expectation effect. Can't remember the author's name actually, but it's really interesting because it talks a lot about how placebo works and things like that. So that's a really interesting book, especially if you go on social media, and lots of people talk about like the sort of like, they talk about the pain sciences and sort of like biopsychosocial modeling and placebo, but actually this really talks about placebo at a societal level and at a neurophysiological level as well. Is a lot of the book, and nocebo as well, how you can bugger things up by using the wrong stuff as well.
Right, I'll definitely check those out. Yeah, no, they're good suggestions. So last question, who would you say, well, actually two questions. So who would you say has been the most influential person within your career?
That's virtually impossible to answer. I've been really lucky that I've always been able to work with people who will challenge your thinking, and they might not even realize they're doing it. Whether that's the athletes you work with, because you've got to be creative, or the people you work with who bring slightly different perspectives on the way you do things, so challenge your approaches. So actually it'd be unfair to identify one or two, because there's just been so many people who've helped me. And I don't even think they've deliberately helped me, and they haven't deliberately hindered me. They've just been around, and I think you've got to be open to just, what am I learning from this? And I think there's I went to an event not so long ago, and it's like networking and making deliberate approaches to people to network. And it's sort of like, as I suppose somebody at the other end now, where people want to interface with, it's almost like, well, what are you going to give me? Because if you're just another experience of another student, in inverted commas, I don't need to interface with you for me to get something from it. So if people are looking for mentors and networking to expand their networks, the best way they're going to get the best out of people is also to give as well as take. And so I suppose I'd like to think in those relationships, as the years have gone on, it's been symbiotic, not parasitic. And we seem to be in a world where people feel it's okay to take and take without offering something back. And they just need to offer something back. I'll give you some smoke now, Andy. In my relationships with you, if I've asked you about kit, you've always been honest about kit, and you've occasionally been generous enough to lend me some kit and let me have access to stuff. So this is like payback for those a little bit, so it is, you've got to have that yin to the yang the whole time, and you'll get more out of it from that. Not just going into it going, what can I get out of this? It probably needs to be, what can I also give?
No, I think it's a really good point. I think that's the case with anything. You would hope that it's not always just right. For example, in our case, what can we try and sell to you or whatever? It's like, right, it may not be now, develop the relationship, and it's not a conscious thing. It's just like being involved in that world and trying to contribute to things. So no, I definitely can empathise with that way of doing things. So definitely last question now. So in terms of like your extensive career, you've already named quite a few of them, but are there any one or two particular moments that has really resonated, whether it's in an athletic setting or behind the scenes as well?
No, I've been dead lucky. If you've stood 2 meters away from Inga Tuingamala when he took out Scott Gibbs in a head-on tackle, and you actually feel the compression wave, or you've been in the stadium at Rio for probably Usain Bolt's last decent 100 meters, when everybody said the stadium looked empty. It wasn't empty. There was 100,000 people in the home straight rocking the house. The Brazilians are crazy when they want to go crazy, and they were stamping, shouting, and it was like panto, cheering Bolt, booing Gatlin. So if you've been to those things, or you felt the gut-wrenching moment when you're with a team all season, the basketball girls, and they lose in the final game of a series, and that absolute depth of depression in a dressing room, you've got to, you live the highs, you live the lows, and there's millions of them, and so there's probably too many. Probably one of my most favorites is still probably the table tennis against France. I was working with the table tennis closely at Rio. And Sam Walker, 100 and oddth in the world, is playing the 12th, 13th in the world. He's 4 points down in the 5th game. This is the 5th match. He comes back 5 points to level it and then takes it. We're 12:30 in the morning. And just the sheer elation of the moment when you've been 2 hours of absolute concentration from the boys to get through. And then the crazy belief, God, if we take this forward, we could beat the Chinese in the next match. You're thinking, no, you can't. But actually being swept along with that, well, maybe we can. That's sport. If anybody wants to know why you do sport, you do it for that stupid moment when Liam Pitchford is winning the first match against the world #1. And you're thinking, it could be on. And then 5 minutes later, he's 3 down, and you're thinking, no, it's not. Let's pack up, we're going home. So yeah, any of a million of those,
Yeah, well, no, you're giving me some good ones there. And then I'll just do one follow up on that then. So how, like you mentioned before about when you're at the game with your dad and you're looking at that, but you're in those instances, you're very much looking at the performance. Like how does that shift in terms of monitoring him physically as well?
It just, over the years, you become, I suppose you understand the beauty of the game for the technical aspects. So that particular game was, I think it was Chelsea against Man City. My dad's a Man City fan. And at the time, the way Mourinho had set up the Chelsea team, it was beautiful. So you had the big centre forward, and you had a wave coming in behind him. So they'd hoik the ball up to him. If you couldn't defend against him, he'd score. If you could defend against him, the ball dropped out and it landed at Lampard's feet, and he's going to score. And it was just the sheer beauty of the way the team had been set up, where he'd almost thought of every eventuality. So that's the bit you look at. You look at performance from a performance perspective rather, and a sheer beauty of movement. You know, you go and watch. I don't know. Let's think of recently. You look at someone moving about a sailing boat, and how they move to maximize what's called the righting moment. So the boat is just right on the edge of tipping over, and the physicality involved in stopping the boat from tipping over is incredible. Or you watch table tennis and they're 10 meters back from a table and they're landing a little tiny ball in a 2 centimeter square area to win the game. So if you solely watch a single sport, you miss out on the beauty of performance in sport. And that's probably the bit I probably will still enjoy when I pack in. I'll still watch sport just for the sheer beauty of sport. And if you focus only on one sport, I think sometimes you miss that, and that's a shame.
Yeah, no, I think that's a great way to finish, the beauty of sport. So Lee, I really appreciate your time. I've got some great information there, and yeah, thank you, and I hope to see you soon.
No worries, mate. Thanks for that.
Cheers, Lee. Thank you.